I want to just point out what makes Greenwich Hospital so unique, and specifically our total joint replacement program. In terms of what our goal here with the program, we really try to provide a comprehensive program, really committing ourselves to providing excellent care throughout the whole continuum of care, the whole experience of joint replacement. We pride ourselves in providing excellent care throughout the entire experience for not only you, but also your families and caregivers. I have the pleasure of working with a multidisciplinary team. In addition to our wonderful surgeons, we have nurses, anesthesiologists, physical therapists, case managers that all are a big part of your care here, and it is patient-centered. What that means is that you are number one on the team, and your experience while you're with us is number one priority. Our goal is to provide patients and your caregivers continuous education throughout this whole experience. So you've heard a little bit about how we have a pre-op education class. So your education does begin before you even have the surgery. It continues while you're here in the surgery, while you're here in the hospital rather, at the bedside, and then it continues when you get home. My role here is to guide you through that entire process. We also, as Dr. Krastowski has spoken about, we provide effective pain management options for every single patient, and with the goal of maximizing your function. And I do want to also highlight that we do promote healing at a holistic level. The mind, body, and spirit is very important. And so we offer alternative medicine, alternative techniques, including healing touch programs, which I have more information up here on my desk about energy techniques and Reiki techniques that are also an option here for you, a free service that we offer here at Greenwich Hospital. But what is my role here at the hospital? So I have the pleasure of working with all the patients that have a total hip or total knee replacement. My job is really to guide them through that experience, pre-operatively with the education class that I'm going to speak about in a minute. But also I round on the patients every day. I go and see the patients at the bedside every day and make sure that their stay here is running smoothly. I do also do bedside education to talk to the patients about what to expect when they leave the hospital. Okay, so our relationship doesn't just end when you leave the hospital. It continues when you get home as well. As a care coordinator, like I said, I've had the pleasure of working with a multidisciplinary team. So I check in with the physical therapists, the nurses, the physicians assistants, the case managers to make sure that your stay here is running smoothly and efficiently. And then, like I've mentioned, I do follow-up calls with you, and I check to make sure everything's going well at home as well. In the pre-op education class, we offer education classes here weekly. They alternate between hip replacement and knee replacement classes. So for instance, this week I held a hip replacement class right here in this room. Next week it'll be knee replacements, and they alternate each week. The class is led by the coordinator, myself. Then you also meet a physical therapist and then a social worker or discharge planner. So you get to meet a few faces, a few people that you're going to see while you're here in the hospital. And you hear a lot of information during the class. You're going to hear about how to prepare for the surgery, what to expect in the weeks leading up to the surgery, about your doctor's visits, how to optimize your health in those weeks leading up to the surgery, and how to physically prepare for the surgery as well. You're going to hear about what to expect on the day of surgery, which Dr. Krastowski was just talking about. I really guide you step by step of what to expect the second you walk into the doors here at the hospital. So that there aren't any surprises, which patients have really given great feedback that really eased a lot of their fears, a lot of their anxieties about the day of surgery, because they've already heard it. They heard it from me, that they already know who they're going to meet and how it's going to proceed. You're going to hear about also what to expect during your hospital stay for when you stay with us for a couple nights. You're going to hear about pain management techniques like Dr. Krastowski talked about. You hear about what to expect from physical therapy. And then we talk about how to prepare for discharge so that you're prepared for going home after the surgery, how to prepare your home, what kind of equipment you're going to need, and then what kind of services you're going to need when you get home as well. But why choose us, right? There's all these hospitals that do joint replacement surgeries in the area, but why choose Greenwich Hospital? So number one, our surgeons are fantastic. As you've heard tonight, they really are top in their field, and they use the latest technologies and surgical techniques. But also they're wonderful people. They're great men and women that we love to work with. and they are part of the team here. In addition to the surgeons, we have fantastic nurses, physical therapists, case managers, anesthesiologists that are experts in their field, but also are very compassionate about this. This is a very well-oiled machine. We've been doing joint replacements here for a while now, and I'm happy to say it runs pretty smoothly. But that's because every person you're going to meet along the way loves what they do, and they love helping people. And that is why we have a 98th percentile. We're in the 98th percentile for patient satisfaction. That's something we're very, very proud of. In addition to that, more patients are going home, and that's a great outcome. But I'm also happy to say that we are top 12 in the nation for lowest readmission rates. We're number 1 in the state for lowest readmission rates. And we have very, very low infection rates, well below the national average. So those are wonderful outcomes that I think are very important and we're very proud of. As Peggy mentioned at the beginning, we do have the Joint Commission's Gold Seal of Approval, which means we comply with the highest standards of care. So we're very proud to hold that honor as well. And then, it really is unique that we provide patient and caregiver education every step of the way. So that is my presentation. If you have any other questions about the program itself, please feel free to call me. This is my job. Total hip replacements, total knee replacements is what I'm living and breathing every day. So please give me a call if you have any other questions, and my cards are up front. Thank you.